We're going to talk about how to sit a patient up and how to lift a patient a little more easily if you're going to wrap the chest after doing surgery. And we're going to have to do a little bit of use your imagination because this is actually a 4-person job and we only have 2. So, anesthesia is going to take care of the head. Obviously, we don't have anesthesia here, so he's going to be his own head. And then you have one person on the right hand side of the patient and one person on the left hand side, and then you have the person who does the wrapping. So use your imagination. Hopefully you get the important part of it is how you take the strain off your back and the strain off your arm. So you have the patient asleep and their arms are going to be out. You don't want to have, and normally if you're the assistant you're going to be doing the wrapping, but you can help the people in the room by teaching them this way to approach it. So you don't want them to lift from here because it's harder on your back. It's more strain on your arms. They actually would do much better if they're up top. It's much easier to push. So you're going to have one on each side. The arm's going to be out. And when the patient lifts, and remember it's 3 people, if you put your arm like beside the shoulder blades, the other person's going to have their arm over here. The pillow obscures it a little bit, but what's important to note is that you rest your elbow on the bed, OR bed, and your other arm on the patient's scapula. And that way, all the pressure and tension is being taken by your arm resting on the bed itself and not on your back. So you're going to have one arm holding behind the shoulder blades. The other arm is going to be holding the patient's arm out so that you can so that the person who's wrapping can actually get under the armpits and get to where they need to be. When she runs into this Velcro, if you're doing one that you need 2 pieces of Velcro, 2 pieces of ACE, then you just want to make sure if there's a little Velcro on the skin that you put a 4x4 under it. So you're holding behind the scapula with one hand, you're holding the arm out with the other, and you can see how you can make it much easier. There's no strain on my back, there's no strain on my arms. The pressure of the body's doing the whole thing, and we can go down now.